knock on the door, verify your order,
Yeah.
introduce yourself, identify the patient, explain what you're gonna do,
Mhm.
wash your hands, gather your supplies, ask about allergies, provide privacy, and ask about pain. So when you ask about pain, you say, are you in any pain? They're like, oh yeah, I'm in a lot of pain. What do you ask them next?
The pain level.
On a scale of 0 to 10, how bad is your pain, right? So, we've established she's not really in any pain. What's the next thing I want to do after I do my beat down? What do I want to do before I do vitals? That's a good point. We do want to get those eventually. What's the first assessment you want to do?
Pain.
You want to do a pain, but that's during review gap.
Orientation and con.
Where you're going to do a head to toe, so you're going to assess everything. What's the first assessment? First assessment.
You guys do, they like, they cognitive abilities and stuff.
Neuro, right?
Symmetry.
Right, so what kind of questions would you ask them? Do you know what today is? What else? Do you know where you're at? Who's the president? What year is it, right? Because if you wait and you're doing this and you're chatting with them, you've got this thing going on, and you get down here and you're examining their abdomen, you say, well, when's your last bowel movement? And they said, 1973. And then they say, you say, well, who's the president? And they go, Bush. Now, can you believe anything they've said to you? And you're already halfway down your assessment, right? So establish that first. Establish where they are. Because if they're not with you, anything that you ask them is not going to make any difference, right? Because it's not going to be real. So we do our neuro assessment first. Now, what do we want to do? You can do vital signs. Absolutely. Get your vital signs done. So where do you want to start? At the head. So what are we doing at the head here?
Checking the head.
Here at scalp, we're looking for any, or feeling for any abrasions, lumps, bumps,
A headache, if they're losing any hair.
all that kind of stuff, right? Because if you're feeling on their head, let's say they have a little bit of dementia, and all of a sudden you feel in a spot and there's a lump there and they go, ow! Maybe they had a fall and nobody knows about it, right? So that we're palpating their head, we're looking for any lice, anything like that, right? Any abscesses, anything. Okay, his head's good. Where do you want to go next? Eyes. What are we going to do with the eyes? The pearlets. So we're going to check for the pupils are equal, round, reactive to light. You do that by taking your pen light. You're going to dim the lights. Take your pen light out to the side. Make sure they're looking forward, and you're going to slowly bring it in. And then you're going to look on the side of your pen light and see what it went to. Then you're going to bring it over to this side and slowly bring it in, right? Same thing. See if it constricts and where it falls on your pen light, okay? Accommodation, you don't need your light. Just need to hold the pen light out about 8 to 10 inches or so away from their face. Have them focus on this and slowly bring it in. Their eyes should converge, meaning they're going to come together, and their pupil should constrict, okay? Do you have one pupil that constricts and one doesn't? Is that a problem?
Yes.
Probably so, yes. So that's the kind of stuff you're looking for. What else with the eyes do we want to look at? Ask them about their vision. If they wear glasses or contacts, right? Because if they wear glasses, now whose responsibility are those glasses? Yours, right? So you need to know whether or not they have them and do they have them with them, right? So what else with the eyes? The color. When you say color, what do you mean? Of this sclera, is it white or is it yellow or discolored? Red, pink, right? The conjunctiva, is it real pink? Any drainage, right? Watering, anything like that? All right. After the eyes, where do we go?
Ears.
Ears. What are we going to do with the ears?
For drainage. Ask them how their hearing is.
Ask them if they wear
If
they wear hearing aids, and do they have them with them, right? Am I going to be yelling at you the whole time, or are you going to get your hearing aids, right? So you want to know whether or not they have them because they are also your responsibility now, right? So find out whether or not they have hearing aids. What else with the ears? Skin. Like when you say skin, what do you mean? Yes, behind the ears. What if they do wear glasses and their glasses are 3 times too small for them? And And now they've worn these abrasions in the back of their ears, right? Or they wear nasal cannula at home, right? So maybe they have abrasions in the back of their ears, so we want to check that out too, right? Anything else with the ears? No. Okay, where do you want to go next? Nose? What are we going to look for in the nose? Drainage. So we're going to shine our light up there, see if they have any kind of drainage. What else are we looking for up there? Redness. Breathing quality, meaning? Right. So, do they have any blockages or obstructions up in their nose, right? It's been broken, maybe it's crooked, right? So, if they have polyps, which are usually benign, their growths up in the nose, right? We need to know that because if all of a sudden their sacs drop to 85% and we put nasal cannula on them, is it going to work very well? No. So we need to know that stuff, right? What's up in their nose? And you can check patent, see if I just have them, and see whether or not they can breathe through their nose, right? Anything else with the nose? Okay, where do you want to go next? Mouth. So what are we looking for with the mouth?
Throat.
Look at the throat. Teeth. What about the teeth? Tell me about that. Do they have dentures and do they have them with them, right? Are those also your responsibility now? Yes, they are, because they're going to be calling you if they can't find them, right? So we need to know if they have dentures, do they have them with them? What else with the mouth? The tongue. What about the tongue?
Pink and moist.
We want it pink and moist, right? All of those mucous membranes, we want pink and moist. We don't want those dry, cracked lips. What about, what else with the tongue? Yeah, any sores? What if they have white patches all over their tongue? Thrush, right? Thrush. Who can get thrush? Who's prone to thrush?
Anybody can get it, but babies.
Babies get it.
Elderly get it.
Elderly, if they are what? That's what a thrush is. It's when their immune systems are depressed and they can't fight things off. So people like cancer patients, people who've had transplants, people with AIDS, all of those people are prone to thrush. What's another category of patient that can have thrush? What are in some inhalers? Bacteria, I hope not. Jeez. What are in some inhalers? What medication? Steroids. Albuterol mixed with steroids, or just steroids, right? If these people are using their steroid inhaler and not rinsing their mouth out, they can get thrush.
Had that happen to me as a kid.
Yep.
I have a really bad asthma.
Yep.
When I was
Yep.
like 10, that happened to me.
Yep. So we're looking for those kind of things, right? Anything else with the mouth, or what do you want to ask them about?
Any problems with chewing or swallowing?
Chewing and swallowing, absolutely, right? We want to know that they can swallow, if they can swallow, right? Absolutely. What else with the face? What do we want to ask them to do?
Like, have them move maybe their head from side to side, make sure they have good range of motion with
Good.
everything.
Make sure there's no swelling or something.
So when you say equal and symmetrical, what kind of things are we going to ask them to do to check that?
Smile.
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 What else? Puff their cheeks out. What else? Stick out your tongue. What else? Raise your eyebrows. Right? So we'll ask them to do those things, because if they smile in one side groups, or they stick their tongue out, goes, what's the problem? It'd be a stroke, right? So we check that symmetry of the face to make sure all that's good. Okay, where do you want to go after the face and the head?
You want to feel the carotid pulse.
Right, and the neck. Does everybody know where to find your carotid pulse? Slide your fingers down your trachea halfway, slide it over right into that groove between this muscle and the trachea, and it lays right there. Lies right there. Okay, can you feel it?
Yeah.
Okay, that's where you're gonna find their carotid pulse. How do we want to feel the carotid pulse? One side at a time, right? Because we don't want them to pass out, because that's the blood supply to the brain, right? All right, so we checked his carotids, those are good. Where do you want to go next?
Chest.
You want to go to the chest. What are we going to do first with the chest?
Look for scars, bruises, any skin tears, or anything.
Maybe old scars, maybe they had open heart. What else are we gonna look at?
For symmetry, to see if like one side is collapsed or not.
Okay, how would you do that? What would it look like? Not yet. We're doing just an inspection. We're looking first. So when you say that, what do you mean? You're looking for symmetry.
The front and back.
One side rises, the other side doesn't. And that can mean a collapsed lung. So we're looking at that. We're looking for that. What else are you looking for?
You're talking about the barrel chest from
Yep.
COPD.
COPDers, they have that barrel chest because the alveoli in the lungs change and it changes their whole rib cage. What else? Is there anything we want to count? Respirations. So we're going to be looking at the rate and the depth of the respirations. How fast or slow are they breathing and how deep or shallow they're breathing, right? So those are all the inspection things we do before we do anything else, right? And that's a good time to stand there and count because if they know you're counting and they know they're breathing fast, but they don't want you to know they're breathing fast because then maybe you're going to do something they don't like. They're going to slow it down, right? They'll hold their breath, they'll do something, right? So, just innocent thing, you're standing there, you're just watching, right? Now what do I want to do? I've inspected, everything looks good. What do I want to do next? Listen. I'm going to listen to the heart first or the lungs first? I'm going to listen to the heart. What part of the heart are we looking at specifically for you guys? Apical pulse. And where do we find that?
The fifth intercostal space.
Mid-clavicular line. So when you do your head to toe, you say, I would listen to the apical pulse at the mid-clavicular line, fifth intercostal space, for how long? A full minute or 60 seconds, right? Either one, okay? For our intents and purposes, that's what we'll do, right? I know that Nurse Eric taught you those little tricks, and if any of you do vital signs, you probably already do those tricks, but for our intents and purposes, you're gonna listen for a full 60 seconds, okay? All right, so we listen to the heart, that sounds fantastic. Now what do we wanna do? Lungs. How many times on the front?
8.
8. How many times on the back? 10. And we're listening for those adventitious sounds, like the wheezing and the crackles. And what do crackles mean? You hear crackles in the lungs? What could that mean?
Pneumonia.
It could be pneumonia. What else could it be?
Kind of fluid.
Some kind of fluid. Some kind of fluids in the lungs, right? What about stridor? Is that a life emergency situation? Yes, because that means that the upper airway has closed off. So that is because they can't get any air in. So those people, a lot of times, if they can't get it resolved, will have to have a trach. Okay? So, or be intubated, one or the other, right? So, we're listening for those things. He sounds great. Where do you want to go next? We're going to the stomach next? Okay. What are we doing with the stomach first? We're going to look at it. And what are we looking for? Big old abdominal wound, obviously. What else? Scars, old scars. Distension of any kind? Anything else? Always look at their skin. Anything else? What? You could, but we already assessed that when we did their breathing. Most adults are chest breathers. Babies are abdominal breathers.
While you're looking, it would be a good time to ask them if they're feeling any pain in their abdomen before
Right.
you start pushing around.
Right? So have you been having any problems? What else would you want to ask them? When's your last bowel movement? What else?
Last time you ate, maybe.
Maybe.
Ask them about urination.
Urination. How's your urination going? Is it frequent? Or, you know, if it's a male, are you getting up in the middle of the night to go? Are you having trouble initiating stream, or is it a stop-start stream, or very weak stream? Those kind of things, right? So we can ask them that. But also, when we're looking at the abdomen, we also want to look to see if they have any G-tubes, colostomies, anything else like that, right? So we've assessed the abdomen, or we've inspected the abdomen. What do we want to do next?
Listen to the bowels.
Listen. You gotta listen. Always listen before you palpate, because if you palpate, you've disrupted the bowel motility. Okay? And you're not gonna get a true evaluation. So we're gonna listen, and where do we start? Right lower, then where do we go?
Right upper.
Right upper,
Left upper.
left upper,
Left lower.
left lower. About how long are we gonna listen for?
A minute to 5 minutes.
About a minute, right, to see if we find something. But if we don't find something, if we don't hear anything, how long are we gonna listen? 5 minutes. If we don't hear anything after 5 minutes, what are we gonna do? They're absent, is that okay? No.
Let the physician know.
Yeah, we gotta let somebody know, right? Hey, listen, this dude doesn't have any bowel sounds, right? Because that means the guy has either a bowel obstruction or an ileus, okay? So.
Would a bowel intussusception cause that too, or would you still hear bowel sounds? I'm just curious. My daughter had one when
Did
she
she?
was a baby.
And they'll be different for sure. They might be decreased. I don't know that they'll be absent. They'll definitely be decreased. Okay, so we listened. He's got good bowel sounds. What do we want to do next? Palpate. What direction? Same. Right lower, right upper, left lower, right? We're asking about any discomfort, right? He's good. We've asked about bowel movements. We've asked about urination. All of that's good. Okay, where do you want to go next?
Arms.
You want to go to the arms. Okay. What are we going to check on the arms?
Brachial pulse.
Going to check the brachial pulse. Where's your brachial pulse? It's on the medial side of your elbow. See if you can find it. Medial side of your elbow. Okay? You check their brachial pulses at the same time. The only ones you feel by them one at a time are the carotids. You want to feel all the other arteries at the same time. Why? Make sure they match. Make sure one side doesn't have a really strong pulse and the other one you can barely feel. Because what can that mean? There's some kind of clot, or there's not as good blood flow in that arm, right? So we check the brachials at the same time, then what do? We want to check the radials at the same time. Where's your radial pulse? On the wrist side, right? Right here, by the thumb, okay? Check those at the same time. What else in the arms?
Range of motion.
Range of motion, so we're going to put them through some range of motion, right? Make sure that that's equal. So let's check their strength, right? So in that video, she showed you the push-pull. You can do that. If there's somebody who can stand, I always told them, well, maybe not. Maybe she wasn't a good person. Go ahead and, no, I'm just kidding. Go ahead and, we told them to take their arms out to the side. I'm going to push down, you push up. You push down, right? Bring your arms out in front. I'm going to push down, you push down. Okay, good. So, the big difference, sorry. Oh, God, you're all banged up from your accident.
I was in a car wreck.
Yeah, oh, I didn't know. You said everything was fine. I wasn't sure.
I mean, I'm here. It's fine.
So, this is the thing. If I would have done this, and I pushed down, and this arm went boom, and she'd been complaining about shoulder pain, what do you think is wrong? Probably rotator cuff, right? So that's what you're looking for. You're looking for asymmetry in their strength, okay? Because that can imply a problem, okay? Sound good?
Yeah.
Okay. What else can we check in the arms?
The refill.
Capillary refill time. We want that less than 3 seconds. What else can we check? Skin turgor, right? And we want that less than
3
seconds, right? Now, when they talked about, some old people have that kind of, so we check it. You can check it on the chest too, okay? So either the wrist or the chest, either one are fine. All right. Anything else with the arms? No. Okay. So where do you want to go next? Hairy area. So we're gonna come down here, and what are we looking for here?
What they gonna turn on? What they gonna turn on? They out at the period area.
Odor, right? All that stuff, right? If they have a Foley, right? All that stuff. What'd you say?
Femoral pulse.
And then in the groin, we're gonna feel the femoral pulse. That's where the femoral pulse is, right here in your groin. You guys can when you're laying in bed tonight, see if you can find your femoral pulse. So you'll know where I'm not kidding.
I'm not doing
So when you're laying in bed, see if you can find your femoral pulse so you have an idea of where that is. Okay? Alright, what can we also do while we're in this area?
Roll them over so that you could go ahead and check the backside.
Right. I mean, really, you could do that anytime, but if you wanted to do it this time, I'm not going to make you guys do that. You can just verbally tell me that because these are very clunky mannequins. They're hard to move. So you would just say, I would roll them over and look at their backside, and you're looking for hemorrhoids.
And any pressure.
any pressure injuries, right? We're looking for all that kind of stuff on the backside. We roll him back, he's good to go. Where do you want to go next? We want to go to the legs. Okay, what are we doing with the legs?
Check the
Popliteal arteries, so behind each knee are the popliteal arteries. What else? I'm sorry? That's in the feet. What are we going to do with the legs? Range of motion. Edema, what kind of edema? Pitting and?
Non-pitting.
Non-pitting, right? So non-pitting edema means what? You know, come on. Just means it does not dent in when you push on it. You can tell it's swollen. It's way big, and it's taut. It's really tight. But when you push on it, it does not dent in at all. That's non-pitting edema. Pitting edema is what? When you push in, it does give you a dent.
What would be the difference of why you would see the two different kinds of swelling? There's one more related to an injury and one more related to other things?
One's more probably related to venous stasis, meaning that the veins are not working well to bring fluid back up to the heart. Because when we're young, we have valves in our veins, right? Our veins are made out of tissue. Our arteries are made out of muscle. They're very strong. Veins are very weak. So when we're young, they have these valves and they push the fluid back up to our heart like this. And then when we get older, it does this. So part of the fluid stays down, part of the fluid goes back up. That's why we use those compression stockings to push those valves together. So now they can work again. So the pitting is different. That means they're holding onto fluid. So like your congestive heart failure patients, those kind of kidney patients, kidney disease, those kind of patients typically are the ones with the pitting edema. Okay? Huh? And they can start seeping. Yes, they can. Yes, they can. They can start oozing out. Right?
Have you ever taken like compression socks off and they're wet?
Yeah.
Yeah, that's why.
Yeah. Yeah.
You
She's
think
little,
it's
has nowhere to
sweating,
go.
It's not. It's literally the fluid.
Yeah. So the big problem with that is what? Infection, because now we're going to have some skin breakdown, right? It's going to get macerated and can break down, and that could be a problem, right? So we want to make sure we get that under control. So yes, edema. And then we mentioned range of motion, and what's the other thing we need to check? Push and pull with the legs. So what I do a lot of times is I just put my hands on top and say push up against my legs, and I'll put my hands underneath and I'll say push down against my legs, right? Just to see if they have that kind of strength, right? All right, anything else with the legs? Okay. So we're gonna move on to the feet. What are we looking for with the feet? We're looking between the toes? Pulses, so which pulses are we looking for? So posterior tibialis is in your inner ankle here. See if you can find yours. It's right by the ankle. It can be hard to find sometimes. Some people have weaker pulses. So in the video she said that the dorsalis pedis is the same as your pedal pulses. Yeah, pedal pulses. They're pedal pulses. But anyway, they're all pedal pulses. Your posterior tibialis and your dorsalis pedis are both pedal pulses, right? They're just two different kinds. So where's your dorsalis pedis? It's on the top of your foot, runs just down from the big toe, right in the middle of the foot. Okay? So then you're gonna feel those at the same time. What else do we want to check in the feet? Yeah, we can do the push-pulls. We can say push down like you're pushing on a gas pedal. Pull back towards your face. Capillary refill time. Check their heels. Very important, right? We want to check their heels, especially if they've been diabetic or sitting around a lot, right? Because what do we find a lot of times here? Either deep pressure injuries or an absolute ulcer that's happened, right? Anything else with the feet?
What is the